An interesting development that's happened in Birmingham just over the past couple of weeks and the past month or so is, if you guys haven't seen in the news, UAB has made a bid to purchase St. Vincent's. And you guys all know St. Vincent's, huge hospital system here in Birmingham, has hospitals now in St. Clair County and Blount County, and I think down in Chilton County. They're really large here. And the fact that UAB has made a bid to essentially purchase them from Ascension is a huge deal. It's going to make UAB a massive hospital. They were already one of the top hospitals within the country and especially in the Southeast. But this merger with St. Vincent's is going to be even larger. Now, we don't know exactly what that means long term. There's still a lot of work to be done to kind of figure that out. But it's a really, really big news story locally. And then just yesterday, we learned that Tennant, who is the owner of Brookwood Baptist System, is selling off their hospital systems in Alabama to a hospital in Orlando, Florida. So basically, Brookwood Baptist, so Brookwood that we know, Princeton, Shelby Baptist, Walker Baptist, those hospitals will no longer be owned by Tennant. They're going to be owned by a hospital system from Orlando, Florida. So really interesting developments in the Birmingham market. For many years, we've had multiple hospital systems. Well, it looks like in the coming years, we're really going to have three big systems. We're going to have a UAB system. We're going to have the Brookwood Baptist system being owned by this hospital system from Orlando, and then Grandview. So I don't think it's going to hurt our area. I think it's actually probably going to help our area long term. Hopefully, it helps all the hospitals grow. We have such a great resource for medical services here anyway. I don't know how it affects Medicare. I don't think it's going to affect insurances really. It could affect some networks, like who your physician accepts and these kinds of things. We don't know whether that it's going to expand it or retract it or whatever that means. We'll see that as time goes. But one of the reasons I always want to talk about that is, as our healthcare systems change regionally, it will have some impacts. And one of the things that we try to do is keep our ear to the ground for any of those types of things that happen, just to be able to be ahead of that, to inform our members and just the general public that, hey, these are things that you need to be aware of.